So let's talk about wisdom teeth. If you're here to get your wisdom teeth out, it's not as bad as everyone says it is. It's going to be a procedure that is not awesome, but it's very doable. First of all, as far as wisdom teeth go, you're going to be put to sleep. And going to sleep is probably the best way to do it. You don't feel anything, feels like it goes very, very fast, and most of the people wake up in their beds. They don't really remember how they get there. It's a very good experience for you. What to expect when you come in to do your wisdom teeth is we're going to take you to a surgery suite. You'll get a little IV started in your arm that's very simple and very easy. We use a very, very, very tiny IV for you. At that point in time, I'll give you some medicine and you'll fall asleep. And while we're doing the procedure, again, you won't remember anything. When you wake up, we'll wake you up very gently and nicely. We'll send you home with whoever brought you. Couple risks of the procedure. When you are getting your wisdom teeth out, there's some nerves and some things you need to watch out for that we'll be very careful of when you're doing the surgery. Some of those nerves can cause a little bit of numbness to your chin or your tongue, and it's very, very, very rare that any of that happens, but it is a possibility. Most of the time it is not a permanent thing that happens, and it doesn't affect your speech or the way you smile. It only affects the way that your chin feels or your tongue feels. Again, very rare. I'll talk to you more about it when you come to the office. After your procedure, most people wake up feeling pretty awesome. They feel really relaxed, feel really good. You're just going to be relaxed and you're going to be able to go home. All your prescriptions will be sent into a pharmacy during your procedure, and they should be ready for you a little bit afterwards. I'm going to give you some numbing medicine during the procedure. That numbing medicine will last anywhere from about 4 to 5 hours, and so you have plenty of time to get home and get comfortable. One of the questions I get a lot is, when can I eat after the procedure? And you can eat pretty much right after it. However, I would stay on easier things to eat, more like liquids and soups and things, and gradually work yourself up to a softer diet. Now, a soft diet is like pasta and soups. It doesn't have to be Jamba Juice. It can be many different things. I would just stay away from crunchy things like chips. Those are going to be your arch nemesis for about a week. You're going to have some holes in there, and you want to be able to make sure you can get the stuff out that goes in there. Gentle rinsing will be perfect after you eat. You won't have any problems with doing that. I wouldn't spray anything or any hard rinsing. If you just do some normal rinsing, you're going to be just fine. Another thing that people always ask me about is pain and swelling. Pain is normal for about 3 to 4 days. It is not the greatest feeling in the world, but I'm going to give you enough pain medicine and antibiotics to be able to take care of this pain. If the pain gets too great, please give me a call. We'll make sure you want to be comfortable, and we'll get you comfortable. Swelling will get worse as days go on for the next 3 days after your surgery. It'll be the worst at about day 3 or 4, and then it'll start getting better. Many people find that ice helps you with the swelling. If you put it on the side of your face, 20 minutes on, 20 minutes off, or whatever feels good to you is perfectly fine. After about 24 to 48 hours, heat is actually very helpful for some people. What I've found that if you get a washcloth and you get it wet, put it in the microwave, and put it on your face while you're watching TV, you're probably going to fall asleep and feel a whole lot better. People tend to like that a lot afterwards. After your procedure, if you're having any issues, please call the office. If nobody's there, it will be connected to someone who can help you. Even if it's midnight, I do not mind a call. We want to make sure that you're taken care of.